Jeannie McCarty has struggled watching her hometown change.
There are such good people in Austin, and see, I get it tore up, sorry guys.
And loved ones die.
I've had 5 family members pass away of drug overdoses.
You yourself?
Yes. So it's pretty dear to my heart.
So dear, she now works as a nurse, joining what she sees as a fight for the town's life. Austin, Indiana only has 4,000 people, but this piece of the American heartland is suddenly at the heart of an epidemic, facing the state's worst outbreak of HIV ever. 89 cases in just 4 months, 17 times more than a typical year. How easy was it for you to get this drug?
Easy.
Much of it fed by a raging drug problem that Joey Madden sadly knows too well.
It's become Austin's favorite pastime because, just they ain't got nothing to do.
A long-time alcoholic, he says last year he began using the town's drug of choice, Opana, a prescription painkiller that addicts here illegally cook and inject. Dirty needles spread disease. Madden caught hepatitis C and says it's a miracle he's HIV negative.
You want to get higher, you don't think about that.
You don't think about HIV?
I never did then. I wouldn't even, I didn't even think about HIV being in Austin.
Austin could be any rural town in America. Factory jobs here began drying up years ago. 1 in 5 now live in poverty.
So you've got pockets of things that, look rougher than others.
With only 7 officers, the police chief struggles to contain the crime in a town plagued by abandoned homes. So what do you say to people when they look at you and say, Chief, there's a drug problem here. Why didn't you stop it?
We're aware of it, and if we could stop it here, we'd stop it everywhere. So there's no magic wand. We fight it every day. It's a war.
To help that fight,
we have signed today an executive order.
The governor recently declared a public health emergency
to stop this HIV outspread in its tracks.
Teams of workers arrived, setting up a command center to offer testing, doctors, and counseling. Even police officers were retrained on how to handle HIV patients, offering them new tools and calming words.
I have worked with hundreds of people with HIV, and I don't have HIV.
All badly needed support that many here worry will disappear when the governor's order expires in 30 days.
When the Indiana State Department of Health pulls out, I don't know where we're going to be left. It's really scary.
Adding to the anger, state budget cuts in 2013 shut down a Planned Parenthood clinic, one of the area's few HIV testing centers. And the town only has 1 doctor, William Cook.
We could have averted this by addressing the drug problem 5-10 years ago, but we didn't. And now we're seeing the end result of that.
But it's an end result the state health department insists was impossible to predict.
In a perfect world, we would have all services available in all counties, but state budget and the reality is that, that's just not the way it is.
A lot of people are saying the health department kind of ignored this county and ignored this problem.
I would say to that the health department works with all 92 local health departments.
She says the state is here for the long haul, devoting considerable resources and launching programs like a needle exchange, where workers give users clean needles for dirty ones. It's controversial and got off to a slow start. When we began asking about it, the state health department's chief spokeswoman stopped the interview.
So that'll be rolling out in the next few days. That's all I have time for.
Why hasn't that started yet?
We have to end the interview. Sorry.
So you're ending the interview now, Amy?
I am ending the interview. We have another reporter waiting. I'm sorry.
So you want to talk about the needle exchange program? Okay.
I just hope and pray one day at a time that...
Many in town appreciate the health department's work.
I'm trying to make a bad situation into a good situation.
Joey Madden's getting help to turn his life around through counseling, his church, and from people like McCarty. Why do you do this?
It could be your family member. It could be mine. That's why.
Neighbor helping neighbor in a town struggling with far more than a disease. That needle exchange program is now up and running. The state's goal is 2 weeks with no new HIV cases. But once that happens, many worry the help will be pulled out and the core problems that led to this outbreak, John, won't be solved.